Welcome to Redoctoring. My name is Dr. Diane, and this is the podcast that allows you to be a different kind of doctor. Thank you so much for tuning in. Today, I have another guest for you who I am so sure we are all going to learn a few bits and tricks that we didn't know doctors can do. Today, I have with me Dr. Tavares. How are you doing?
I'm doing well, thanks, Dan. I'm excited to be on the podcast today.
Thank you so much. Thank you so much for coming. You have a history with regards to scholarships and with just stepping away from the non-traditional path. And I really feel like this conversation can impact and help other doctors think beyond what we have been always trained to believe, which is you need to stay in the hospital.
Yeah, so I mean, it's been an interesting path for me. I think for me, it's really been medicine has been something I've loved and enjoyed since the beginning. But I must say, I feel like walking out of med school, I studied at the University of Stellenbosch. I feel like I walked out of there with more than just a medical degree. So I think I'll tell you a little bit more about the scholarships and the leadership journeys and just being more involved in communities and how it got me here. But it's been an exciting journey.
No, no, definitely, definitely. Let's start from the beginning. Why did you become a doctor? Or like, what was your thinking around that?
So, I mean, this is a funny question. I think, firstly, I come from sort of the stereotypical Indian family where, you had a few options growing up. Either you became a doctor or a lawyer or an engineer. And so, I mean, coming from a family of people aspiring to be a doctor, I'd always looked up to doctors. And both my sister and I are first generation university students. I was the first doctor in the family. So it was always something that was just highlighted as one of these amazing careers that you should follow and pursue in life. So that was one of the reasons. Yeah, maybe a little bit of following the stereotype. But I think the other thing was that I grew up with a dad who worked in the police force. And very early on in the police force, during one of his medical checkups, I was very young at the time. They picked up sort of a nodule in his lung, and it ended up being sort of cancer. Um, and so, very quickly and very early, medical intervention took place, and they were able to do sort of a pneumonectomy, so removal of that lung. And my dad is well and alive and is doing really well today. And so, I think growing up in that space of having to go into hospitals and visit your dad and see the way that modern medicine has helped him and allowed him to survive has been something inspiring for me. So I think it was those two components of actually seeing what medicine does and then also aspiring to be a medical doctor. Um, yeah, so I think that's really, really where it comes from. I, at the center of it, love working with people and I love being around people. And so I think that's also what's made it more enjoyable to be going down that route.
No, definitely. I relate to when you said that, sometimes you grow up in a family where, the career paths are set up for you. And that story either ends with my parents were correct and they gave me a lot of wisdom, or it ends up as my parents were wrong and I went into something totally different. But it sounds like you appreciate the path that your parents advised.
hmm I agree. I think I did. I think, I mean, of course, in retrospect, when we talk about a lot of the issues we're facing as young doctors in South Africa, you're just like, there's a lot of regret sometimes, or there's a lot of retrospective sort of thinking about, should I have actually listened to their advice? But I think I want to take it on a positive route of like, this is the degree of opportunity and how do we unlock that within ourselves?
Which is a very important take to have. With
Mhm.
regards to university, you said you studied at the University of Stellenbosch.
That's correct, yes.
How was that? How was medical school for you?
So I think Stellenbosch University is an interesting institution, and I mean, I moved to Cape Town at quite a young age, and I'd always wanted to go to either Stellenbosch or UCT. I really, really enjoyed my time at Stellenbosch University, and the reason being is, like I said a bit earlier, is that I was allowed to immerse myself into the experience of not just the medical degree, but student leadership. Um, and so even at Stellenbosch University, I served as sort of vice president of my residence. I served as the Student Representative Council chairperson for the Faculty of Medicine and Health Sciences. And that's really where I started to get to see the importance of social capital, the importance of building that part of your side, of your brand, if you want to put it that way. And then the importance of actually, what I talk about in terms of being sort of a transformational leader versus a transactional leader. And I think, going through Stellenbosch University during the time of sort of the Fees Must Fall movement and sort of the language debates, you really start to internalize the problems that South Africans face, the most marginalized South Africans face. And building that social capital allows you to be, I think, um, enmeshed into the fabric of South Africa and allows you to be a better doctor and a better person, I think. So I think Stellenbosch University allowed me to go down that journey and allowed me to really think a little bit more about what it means to be a South African person and a South African Indian in context of our difficult past. Yeah, I'm very grateful. And it's an institution that's really paved the way for me.
Hmm. You mentioned transformational versus a transactional leader. Can you define what the two mean?
So I think it's a difficult one, but I think, in student
Mm,
leadership, for example, and leadership in general, you serve a body of constituents that want changes and want changes fast. And naturally, that is the case when people are struggling and people are hurt and when people want change. Um, but when you come to face reality of what slow bureaucratic processes need to take place before change can happen, if you do things too fast, it's not sustainable, it doesn't last long, and it doesn't actually change the attitudes and the perceptions that people have in society. So I think when it comes to transformation leadership, it's like, how do we want to transform society? And it involves not just making things appear or making things happen overnight, but it involves really getting people on board and getting a buy-in and really making people understand the importance of what transformation is. So I think sometimes for me, transformation means that I might never see it in my lifetime, but I want to be part of sort of building and sowing those seeds to see it a bit later. Um, I mean, yeah, a few examples would be, for example, I know um, back then when I was a student, we were fighting for like free internet, and we were maybe even
mm,
posing maybe like a smoke-free campus as health professionals. I mean, a lot of people didn't like that, but when I go back to university, I see now the students are like, yes, we have this and we have that and we have these things, and I was like, back
mm,
then, those were things that I was going into the faculty's office every other day to sort of fight for. And I didn't see it when I was a student, but I'm seeing it now. And I'm seeing it now in a more sustainable way, in a way that's happened um, transformationally.
mm. No, that sounds very deep. Like the way that you put it, that as a leader, you are fighting for change for the next people to come. I think sometimes it's very easy to believe that I'm fighting for change for myself. And I think that's what traps a lot of people in when they think about leaders or like trying to judge how good our leaders are doing because you want to feel the change right now.
Yeah, I agree. I think it's a tough one to navigate, but I think it's one of those things that you just need to slowly learn how to navigate and how to do a bit better. And I think there's a space for transactional leadership. I don't think we should wait for everything. I think that there are moments and times, but I think at the value and the core should be transformation. Um, yeah.
It's more sustainable. It's more sustainable in the long run. You sounded like a very multifaceted medical student. You were doing medicine, you were also doing things in your res, changing things. How has that played into you now being a working professional?
I must say, when it came to me doing the medical pivot, it was the things that I had done in university that were out of medicine that actually helped me. So I think, for example, people don't realize, for example, the importance of student leadership. For example, in my case, being chairperson um, has really been able to sort of catapult my career in a different direction, is because I can say during student leadership, I worked in an administrative role, in an operational role. I had to deal with finances, just things, that you can't necessarily say that your medical degree teaches you. Um, and then also, working in a big team. um, really have a public facing skill set that maybe other people don't have. So, I mean, that definitely helped me when I wanted to go more into the public health space, when I was working a little bit with Kiredi, which was the mobile health clinics, which we were doing in the Western Cape and other parts of South Africa. But I think the other important thing to say is that um, I think it's really important to know that life is not just medicine. It's also family, it's also friends, it's also your spirituality or whatever it is that you want it to be. And so, even as a student, you need to find time to cultivate those aspects of yourself. Um, so for me, I think when I came out of medicine and I was struggling a little bit, like all of us post-comserve feel like we're in a space where it's quite difficult, I started to pull on those strings to say, I'm more than just a doctor. These are the other things that I've been doing. These are the other things I can look at, and I can send out my CV into those spaces as well and see if, something lands. Um, but equally so, when we get posted in the most rural parts of South Africa for a community service, and we get a little bit jealous of the doctors that get posted in some of the metropolitan regions in a specific speciality, we don't realize that sometimes being in a general field, so doing family medicine in your community service here in the most rural community, really sets you up for post-com serve in this difficult space where you don't know where you'll be, but you realize you have a skill in all the disciplines. You've been doing that for the year, you're competent in it, so you can actually fall into a space and find your space a little bit better, or take some time to introspect before you get caught up in a discipline that you may not even like in the first place. So there is a positive outlook that you can have in any situation that I think you find yourself in. It doesn't take away from the fact that, there is this big unemployment crisis and there is the struggle that we're experiencing. But I think it is a mindset shift that also needs to happen for you to, get past that first speed bump.
I love how you mentioned that you fell back to the things that you were doing in varsity, so like the strengths that you had developed. I think it's one of the things that I regret from my university time. I fell into the trap of how medicine is marketed, that because it's so over consuming, you need to focus on your degree, and that is the only thing that you need to take from university. When there's so many experiences and people and things that you can take that will also lead to other things in the future.
Yeah. I mean, there's a balance. I can tell you there were some times where I was like, what on earth am I doing in student leadership? It was just difficult to also navigate. So I think, yes, I think do what you can and what you love when it's extra, but find that balance. I think it's equally important to focus on your medical degree, and finding that balance is really what needs to happen.
So now, when you did your internship and your community service, did you start to feel then that you wanted to step away from the traditional clinical medicine path, or was that something that only came up post ComServe?
So definitely post community service. During internship and community service years, I had a really, really lovely time. I was fortunate enough to do my internship in Durban, so I went back and actually visited some family and had some time there. And I also then split my community service year between the rural Eastern Cape and rural Western Cape, where I was first working in MDR TB and primary healthcare, and then completely primary healthcare and emergency medicine. Um, and I think during that time, I was very much dead set on becoming a physician. So I was planning to do all these exams that we need to do in order to get a post. I had written my FCP Part 1s. I had done my HIV diploma or management diploma. I had like been setting myself up for this internal medicine post. But I was never applying for any internal medicine post. And I don't know why, if it was just subconsciously something telling me like, this is maybe not for you and you should start exploring something different. So it was not making any sense to myself either. Like, why are you pursuing all of these exams, but not even applying for the post when they do open up? Um, what's going on here? So I think towards the end of community service year, I realized that there was a lack of posts, and there was a research in a company that was working within my hospital And I just reached out to them and said, hey, I'm going to be, post community service next year, and I'd really like to know if you guys have any medical research officer posts available. And they sort of, yes, they were like, yes, sure, come do an interview with us. And I interviewed and I started doing sort of medical research post community service. Um, but it wasn't clinical research. And I think part of the thing that I knew I liked a lot was working with people. And so essentially, within 6 to 7 months on that role, that's sort of where I made my pivot out into sort of the public health, medical management, social impact, and philanthropy pieces of work. Um, so to answer your question, I thought I had a plan and a vision, but I think subconsciously something else was pulling me in a different direction.
It's important. It's important to be open to what the path eventually becomes. I think a rude awakening for a lot of medical students, actually post community service doctors, is the fact that you have put in your imagination, you've imagined your career being one thing, and sometimes the road can lead to another thing. So it's important to be open minded.
Yeah, I think it's important to be open-minded, and I think it's also important to sit down with yourself and actually tell yourself what is your motivation. Like, I mean, a lot of people are money motivated, and is that a wrong thing? So just sit with yourself and be honest. Like, if you are money motivated, then what is it that you need to do for that? But if you are motivated towards making social impact, or having a job that fulfills your life in terms of the gains you may see in society 10 years down the line, then where do you need to be? If you're motivated by, changing one person's life at a time and having that interaction, sort of what career takes you down that line? Or, if you're motivated about, being with family and having more family time, so sort of what career gets you that? So I think it's important to be honest with yourself and not lie to yourself if your motivation falls within, the different realms that it can fall into, because I think oftentimes you come out of being a medical doctor and um, there's this narrative that you need to be this person that's pushing all the time at work to be this person for people and communities. And that's great and that's amazing. And I think, that's something that I believe in. But if you don't believe in that, then it's going to be a hard, hard road, you know?
No, definitely. I think it's about finding your why and also what you want your life to feel like, and then
Exactly.
making your career around that. With regards to research, you said you were in research for a few months. What type of person gets into research? Because I think I did not enjoy research in medical school. So I thought that that is how research is as a job. Can you elaborate or tell us a bit more about how is research as a job?
So it depends, right? I would say in my case scenario, I there was not many sort of qualifications that were needed. Like I didn't need to be an experienced researcher to get into this particular role because it wasn't a clinical research job. So it was more data collection. We were working for a trauma study, and we were essentially trying to see sort of what the impact is on time from a emergency to an intervention and how that impacts on mortality and morbidity. And so it was really tracking patients and using that data to get that information. I mean, there's some people that, when you want to get into a research post, I mean, the first basic steps would be to get a good clinical practice certification and just to put yourself out there. I know a lot of people have done sort of publications during med school. I had never done one. I'd always felt like research was just this, I had a block around it and I felt really nervous about doing it. Um, and so it was only really in the research post that I had actually started to develop the skill of, how to come forward with a research topic, how to, do a literature review, sort of think about what you're wanting to answer, versus just pulling, at like, I just want to do a research project. I think research is important, and I think that research should be not a duplication of other people's work. It should be really filling in the gaps of the medical science. So I learned that during that post, and it actually, even at the moment, I'm currently working on a piece of research around the mobile health clinics and the impact it has on the youth. but I never thought I'd even get to that stage in my life where I'd actually think, I'd be, authoring this piece of work. Um, but so yes, I think whether you have a passion for research or whether you want to learn a little bit more, I think it's worth the try to like reach out and actually tell people that this is what you're interested in and you just want to develop that skill. I think that's important. And then clinical research, I can't even speak to. I know a lot of friends have done it, and that's also it's a different ball game, and it's equally exciting because you do get to work with people. And so I missed that interaction with people, and that's sort of what led me to the next thing.
You mentioned that you had to put yourself out there a lot with regards to research. Are there any other soft skills that you noticed that you picked up in that area, or like even in from your time of working in medicine, and then you had to like translate that into where you're at now?
That's a good one. I think I don't know if necessarily I can speak to specific skills, but I think for me, what the research part of my time taught me where I am now is that research is meticulous. You need to be ordered, you need to be meticulous, you need to be um, making sure that everything you do is factual and real. And I think one of the things that I pulled from that into my previous roles where I was working in social impact was being able to dot your I's and check your T's and being meticulous in everything that you do and be orderly, which has really, really been great in terms of how do you build a team, how do you manage a team, how do you ensure that you are delivering what needs to be delivered. And so I think that's really where the research skills came into play, meeting targets. Um, Also, I mean, the research was funded by the USA. And so I think even working with a global partner, just learning the language of the world and how people operate across the country or across the globe is another skill that people need to learn. I think there's so many different cultures out there that you need to figure out how to work with those cultures as well. So I think those are some of the things that I've learned from there.
Oh no, that's incredible. I think so many times in life you think that you're only just gaining the skill in your work, but there's also a whole bunch of little nuggets that are attached to that in order to make you do the work. So it's beautiful to think of your job as also personal development because you are also being sharpened in the process.
Correct.
So now you went into the public health space after research. How was public health? I think public health is one of the most popular non-clinical paths that doctors can take, but not a lot of people actually speak to what it's actually about.
So I think for this one, I'm going to tell you a little bit of a quick story because I I didn't even know I was entering sort of the public health space when I was entering it. All I knew was that a friend called me up and said, "Hey, there's this job called Kireri, which means I am ready, and it's this public-facing campaign. It's meant to be a youth campaign run by young doctors, and we're supposed to be busting COVID-19 vaccine myths and, speaking a little bit about other primary healthcare preventative measures. Um, and, in order to be a part of this job, you need to have like some sort of social media presence or be able to be part of social media. So like doing videos on TikTok and Instagram and Facebook. And the other component is that there's these mobile clinics. So we have these 46 mobile clinics across 4 provinces in South Africa. And not only are we going to be doing this campaign, we're also going to be going out into these communities and actually delivering the vaccines or whatever medication is needed in these communities. And I was like, that's brilliant. I love that idea of, taking healthcare to where people need it. Because we know in the South African context, it's expensive to get transport to health clinics. We know the stigma that exists around local clinics and hospitals. And so this idea of breaking that stigma and being accessible was like really, really exciting to me. And I thought this is like where I see our public health system, um, evolving into. Um, and but I thought that the social media part was cringe. Like I had not done that. I was just so uncomfortable with the idea of like going on camera and telling people, this is the next best thing. This is what evidence-based medicine is. It was just not me. And I think it's just because I scrutinized myself so much that I would have nitpicked everything about myself in every video. Um, and so this person, phoned me up and said, you were very involved as an intern, like being even on an internship, like leadership body. This is something you would love to do. And so I just, dropped my CV in and interviewed, and they was like, this is just an 8 months post. And I took the risk because I was leaving a sort of a 5-year contract to go to an 8 months post because, um, like I said, I was not really getting fulfilled by the research role. And so I took the risk and I went out there, and I have so much more respect for people that do social media and influence using a evidence-based sort of public medicine background. And in this role, I had first started as a young doctor. I had realized how, even though this was a project funded by the German Development Bank and implemented by the trust, who I eventually started working for, um, it was so embedded into the South African government in terms of partnership and collaboration. And so I really got to see how, for example, I can at least speak for the Western Cape, how the public health department works and engages with communities. I saw a little bit about how the bodies are structured. As a doctor sitting in a clinic, you know about the district, but you don't really know what's happening in the district office. The people working in that office, sort of what rules and regulations they need to comply with, sort of what makes some of the bottlenecks, that you experience in a hospital. Like we don't actually sit in a hospital knowing what the bottlenecks are, and so we end up being so frustrated. And equally so, there are so many officials that are sitting in district office that are equally frustrated about the bottlenecks that they experience. So I think learning a little bit more about the public health system and seeing where those bottlenecks are, it's you know made me reframe the way I think about public health in South Africa. Um, both in a positive and a negative way. I'm not saying that everyone's doing their job and everything's getting done. Of course, there's always that aspect of like a lot of apathy in the space that's not allowing us to really progress as a country. So that's where my first sort of um, you know interaction with the public health sector came into play. And because we were funded, externally, we had a lot of more room to play around with like what we thought would be the best way to move the project forward, and then sort of report to our Department of Health and the provincial departments to say, this is what we're doing, this is how we can support, this is how we can help. And I think that autonomy was really great to have.
No, autonomy is a very big part of how we are supposed to position ourselves towards the community. I love how you mentioned that even though the project was funded by a German company, it was still embedded so deeply within our system that the impact and everything was definitely driving change within communities, which is important. I think sometimes some people hear when things are funded by external countries or external people, it's hard to see, or it's hard to even let yourself imagine that this can actually be something good for our community.
Yeah, I think I mean that's the big question of global funders and whether they truly understand the South African context and whether the funding that they put into place here in South Africa, but just the global South in general, how sustainable that is. And so I think there is a move towards funders really, really taking their time to form partnerships and collaborate so that there is sustainability even when they pull out their funding. I mean, we've seen that recently, with some of the cuts that we've had from funding around HIV and TB and the effect that that's had on our country. So really, I think that's a conversation that's slowly starting to build up as well. How does the global North support the global South without um, with communities rather than sort of building with communities rather than for communities. So I think that's important.
Oh, definitely, definitely. I think another important thing is seeing social media also as part of public health because that's where the public is. Everyone is online, everyone is finding the information online. The other day, I actually read how Gen Z uses TikTok as a search engine as opposed to Google, which is
Yeah.
incredible.
No, I mean, listen, we at Keredi noticed a big surge, for example, in social media. Thousands of followers on TikTok, Facebook, Instagram. We had a WhatsApp line with over 100,000 users across our country, just sending in messages about, mainly sexual and reproductive health, HIV, and sort of other infectious diseases. And so we found that quite interesting, actually, because we realized that young people struggle to speak to health practitioners at the clinics, and how important social media is in terms of breaking stigmas, in terms of informing people about specifically sexual and reproductive health. And it's great because the other thing is that um, we are a diverse country. We have so many languages, and so the medical doctors that are creating content in our South African languages are really, really doing amazing work because they're actually making healthcare much more accessible to people. And I think that diversity of influences using an evidence-based framework are really, really making significant changes that we are not necessarily seeing. Um, and I think the other important thing is like it is just to be careful because there are a lot of misinformation on our social media and unregulated. And so I think that's what we're really, really worried about is like how do we ensure that we are delivering information that is really evidence based. And so that's I think one of the key things to like navigate around social media, which is still a difficulty I think the world is facing.
Social media is still quite new in the sense that it started existing in our lifetimes. But I am positive and I'm excited to see positive change and positive impact come from it. I'm certain that as much as there's a lot of negative things happening, if everyone who wants to do good and drive good
Hmm.
momentum comes together, that we can eventually overflow or like let the negativity part topple over.
Yeah,
So you were at DG Murray for about 2 years. Did you
that's correct.
plan to leave, or how did the next chapter come about?
So, I mean, just to put it in context, so Keredi was a project under the DG Murray Trust. So I'd spent about a year with Keredi. And of course, it was a pilot project. It was meant to be for, during the COVID-19 pandemic. And as we saw that trend of, the pandemic sort of decline, the project came to an end. And yes, the project exists now on a virtual platform um, a platform for teen and youth agency and identity. So it still exists in terms of the platforms for support and health, but the mobile health clinics got integrated into the provincial departments of health. And so I realized, my time at Kennedy was coming to an end and I needed to, figure out where I wanted to go. And so this was actually where I was having that internal battle of like, okay, I have my HCPs, I have my HIV diploma, do I now go back into internal medicine? Because, we struggle with the options available to us, especially when we're taught in medical school that our trajectory in life needs to be towards becoming a consultant. And this idea gets embedded into us as young doctors that that's really what we need to be pushing and fighting for so often. So even then, like not too long ago, I was still considering getting back onto the traditional route because I had sort of lost hope in terms of ideas of where to go. Um, and my CEO of the DG Mai Trust called me up and said, there's a post available for the innovation director for the portfolio All Children on Track. And I said, okay, that's interesting. Like, am I able to do this? And he was like, you have already led a project in the Western Cape. You've shown what you can do in this particular space. And so you'll really learn on the go. And as long as you are dedicated to the work and are hardworking and are committed to the cause, the other parts you'll learn. And so I think that was really special to me. My CEO at the DG Managed Trust was also a medical doctor, post community service, went off and started a couple of organizations and trusts, and really is an inspiring person. So maybe another great person to sort of
Wow.
see what that pivot looks like. And I think that was really the courage that I needed, someone to tell me that they are willing to sort of hold my hand through this process. And so when I came into the DJ Meyer Trust, and as a director for All Children on Track, I was, elated. I thought this was like the most amazing space to be. It is an amazing space to be. And it was really around how do we unlock the potential in every South African. And my portfolio was how do we unlock the potential in children from birth up until the age of 10. We had a youth portfolio that sort of took over from there. And then we had another portfolio that dealt with sort of an inclusive and innovative society, all led by a different director. And so I was like, I'm a doctor, I know early childhood development, and boy, was I wrong. Because I knew it from just the way we think about childhood development in terms of, the developmental milestones, in terms of stunting, we know, what the protocol is for a severely acute malnourished child. And so, yes, I knew all of those components, sure. But when I came into the space, I realized that number one, it was not just, thinking about, the clinical criteria of development, but it was about managing a fund or doing strategic investments in early childhood development in South Africa.
How did you navigate learning all the new parts? Because you only had the medical knowledge that you had acquired. So now the funding, the just everything about business and all of that. How did you navigate all of learning all of that?
Yeah, so I mean, in the trust, we were sort of doing a few pieces of work, right? We were doing strategic investments in early childhood development. So I was saying a bit earlier that we were supporting nonprofits in different communities in South Africa to mobilize towards supporting children around early childhood development, preventing nutritional stunting, foundational learning, and responsive caregiving. And so I had known from a clinical perspective, like you said, how to manage a few of those things. Um, but then this is really where it came into play. Like I was mentioning earlier, all the things that I had done out of medicine was really now coming to support this. So managing a team, I had done that, in some of the leadership positions. Managing the operations, I had done that sort of in the research side of things. Just the day-to-day operations, I had been doing that in previous, in previous parts of my life. And then, yes, when it came to the finance part of, how do you, make sure that the millions of rands that you're distributing, that you do a risk assessment, that there's due diligence that's being done, that you are really, really making sure that the funds that you're distributing are used appropriately, seeing sort of in those budget line items where the funds are being used and, if they're being misused, how to go about doing it. And I think I firstly started off by saying, I have zero idea how to do this. This is something that I need to build and develop as I go across this line. And so being honest with my team and my senior team from the get-go, they were like, sure. So we're going to pull you into the finance risk and audit committee meeting. We're going to pull you into these meetings so you can sit and listen and observe and ask the questions. And so it's really about also being in that supportive team. I know, it's difficult for me to say that when we know what the medical hierarchy looks like and how toxicity can flow into our workspaces, where we don't always feel like that's something that we can do or ask for. But in my space, working in civil society, and I think that there was the support that was given to me to allow myself to get to that point. Um, and I think that, it takes immense intellectual ability to do a medical degree. And so sometimes you need to back yourself and say, I can go and do more and I can, branch out and I can learn and I do have that ability in me to do that. So I think it's also backing yourself because I think the imposter syndrome of even pivoting, and the imposter syndrome of even going down a speciality, either or, exists. And so, you need to figure out how to either live with it or to battle it and fight it, and sort of back yourself. Um, so yeah, that's sort of how I got into that post, and it was incredibly special because, one of the things that I struggled with as a doctor was I always thought that people came, especially in internal medicine, for end life care, and that
Wow.
frustrated me. And then working on the opposing end of the spectrum of like working for children and with children, it was like this great space of like preventative medicine through civil society, by doing systems level change that I could see maybe, in 20 years down the line that this could impact this child's life significantly, that they can contribute and, develop their potential. So I found the work to be very catalytic. Um, for better South Africa, if I can put it that way.
Yes. It sounds like by going on the other spectrum of being a doctor and helping patients, it helped to even heal a part of what you had with medicine. Because from on the one side in internal medicine, you're seeing a lot of death, and then the other side, you're seeing how systemic change can actually help impact a whole new generation.
Agreed, agreed. Um, yeah, and I think, to answer the thing of like how did I use medicine in this space? And I think one of the good examples is one of the opportunities that I was working with was nutrition. And so when I came into the trust, I was like, feed the children, like just give everyone food. Like, South Africa has enough food to feed our population, and we have so much of food wastage in our country. And because of, our poverty level, not everyone gets access to food. And I was like, sure, just do that. And then it came down to be like, well, we don't have enough money to feed everyone, we can't possibly. So what is it that we can do that can make a difference? And so it was like, okay, let's go back. Let's look at pregnant women and say, a third of childbearing women in South Africa are iron deficient. So let's start looking at those medications. Are we giving women that are pregnant enough iron and folate supplementation? Should we be giving them something different? Does that something different exist on our essential medicine list? How do we get it onto that essential medicine list?
Wow.
So it was really going there. And then I, as a medical doctor, can say, I know about these things. I know sort of, what requirements are needed. I can do research into, what's the best level of iron, supplementation that would be appropriate, and kind of supporting those initiatives to see if we can get that on track would make a big difference towards a pregnant woman and the children that are born. And then, further to that, when we look at malnutrition, so 25% of our children in South Africa under the age of 5 are stunted. And so
Sure.
that's an incredible like statistics. Like just it's fascinating to just look back and say that is actually what's happening in our country. And so it's not to say we need to go and be a feeding scheme necessarily, but it's to say how do we support and prevent stunting, and what does it take to do that? So even in my medical background, it's to say how do we make sure that mothers are nourished during their pregnancy, but how do we make sure that when a child is a low birth weight baby, how do we make sure that they get the adequate nutrition so that they ultimately are not stunted? And so, using the community healthcare system, going out into communities, detecting those issues early on, we're hoping to make those gains and to see that acceleration in children going forward. So, I mean, that's really the beauty of medicine in that sense, because you could
Mm.
really, really tackle that problem with saying, I know what it's like to manage a SAM or a severely acute malnourished baby. And now I'm getting to see this different angle of how we can tackle that problem. Um, and it's not necessarily the 10 steps, the 10 clinical steps that we use to do that. So it was
Mm.
great to have both sides of the picture, and it was also great to see what civil society is doing outside of the hospital setting to make this happening. Um, so that was the beauty of it. That's what sort of reignited the medical, doctor in me in this space. So yeah, it was a beautiful time at the DG Murray Trust.
Yes, you. It sounds like you really flourished in that space, in that line of thinking and everything. Is that also what sparked your intrigue towards doing an MBA and studying further?
Yeah, so I think as I was going through the role, I mean, like I said, the one thing that I always experienced in everything and is this idea of imposter syndrome, where I was like, I'm doing this great work, but I feel like I do need to credentialize myself in certain areas. Like, I think, in terms of finance, it would be great. In terms of developing a little bit more of a framework around strategy, I thought that would also be great. And as I was thinking about it, I thought, should I do a master's in public health? And that was one of the considerations I had. But then I realized that, I wanted to learn a little bit more about these other aspects that are not necessarily embedded into the MPH. And so that's when I started doing my research around the MBA. So yes, I think that's sort of really what this role was really what pushed me towards researching a little bit more about the MBA, wanting to credentialize myself, and then come back into the space a little bit stronger, a little bit better. And even when I was leaving, I spoke to some of the other CEOs of other organizations and said, I feel this imposter syndrome to go out and come back. And they were like, this imposter syndrome, it never goes away. So you need to either make it become your best friend, especially if you're someone that, scrutinizes yourself a lot. And so, yeah, that's something I'm still thinking about and something I'm still learning about, like how to, you know, even after this MBA, will I feel a little bit stronger or a bit better? And so that's really what I need to figure out as well on my side.
Yeah. No, previously you mentioned that because medicine is such a intellectually high degree, I always tell myself if I could become a doctor, I can do anything. Like this was on top, so everything else is therefore a bit lower. Maybe not the best set of
No,
words
it's
to use,
incredible.
but I always just tell myself that you just need to hype yourself.
I agree with you. I think it's incredibly demanding sort of job and career. And so I think, yeah, back yourself.
So now with the MBA, you chose to go the scholarship route. How did you research with the scholarships and how did you decide on, did you only apply for one? Did you apply for everything? How did you go about that?
Okay, so I mean, I'm going to give you a bit of a rundown for anyone who wants to do an MBA. So firstly, I'd been speaking about the MBA for about 2 years. I mean, my housemates are tired of me because it was all I was speaking about. So firstly, I mean, most MBA programs, you have to look into it. In the States, most of them are 2-year programs. In the UK, you have 1-year programs. And I knew that I didn't have the luxury of going out and being unemployed for 2 years. So I thought, the 1-year programs was something that I was more interested in, and it would allow me to return to work a little bit sooner. And then I also wanted to be in a very strong program, a program that I thought would be a great place to establish a new network and to be inspired by like sort of a global perspective. So I think in South Africa we have amazing MBA programs. A lot of our programs are triple accredited, so looking at your accreditation of the MBA program and where you want to go is also important. So do some research about that. But a lot of the MBAs require you to write a test, which is called the GMAT, which is the General Management Assessment Test. And so I don't
Wow.
know if you recall the trauma of NVTs, but it was
Yes.
basically a similar one of getting into an MBA. So, a quantitative section, a literacy section or English section, and a data insight section. So I had to go back to doing, algebra and statistics and probability, etc. And so really it's this really big exam that you have to do to get in, and different schools accept different types of scores. And so essentially I had to first do the GMAT. And let me just tell you, it was so difficult. I had to do it twice because I was not happy with my mark the first time.
No.
And so, yeah, it was just that realization that, there are other subject matters out there that you're not an expert in. And so it requires a lot of more attention and time to do it. And so that was also a nice like challenge for me in a sense, because it was just nice to be like, okay, I'm going to come back at it again and do it. Um, and then after that, you can make your application. So I had applied for Chevening, the scholarship, last year, and you'll see Chevening is opened, towards September, um, going into towards December, of every year. And so I had applied for Chevening, and I realized with Chevening, you're allowed to put three university options as your choices. And I put down the University of Cambridge as my first choice, the University of Oxford as my second choice, and the University College of London as my third choice. It needs to be all UK-based institutions because Chevening is a foreign common and development officer offers scholarship, so with the British government. And so these were the three choices that I had put down. And the UCL, for example, one was uh, a MBA that was an MBA in healthcare. The Oxford MBA had a healthcare sort of section, and the University of Cambridge had a concentration in healthcare strategies. So I had looked at all the MBAs and I said, these are MBAs that will also offer me um, the part where I can develop a little bit more of my medical background and look at, business and medicine or strategy and medicine or whatever it was that I was interested in. So I'd applied for those processes. They are very expensive processes to do. Like, every application has a cost that you need to do. And so um, For example, I didn't get to applying for the Oxford MBA because I'd missed the deadline on that, so I just applied for two places. And so um, when I had found out that I got I got an interview for the Chevening scholarship, I actually only then started putting in my applications for the MBA programs. And then slowly but surely started getting interviews at each institution, so interviewing both at UCL and at Cambridge. And really, in this process, it's been so great because, I mean, you have to write 1,001 essays
Oh
in each one of
no.
these applications. But really, the essays were so helpful because, the essays were really around you articulating what your 5-year plan is, what your 10-year plan is, what do you expect to gain out of this program. And so, really, when you sit down and you start thinking about those things, you start to map out a little bit more what you're interested in. But I recall sitting in, for example, my Cambridge MBA interview with the director of the program, and the one thing she was fascinated about, and I was trying to, write this application that was businessy, and like, it was going to, speak to them like I had had some experience in business or creating things, and I was like very little experience in that. And so in one of the essays, they asked what was the time that you had the best team or managed the best team. And I thought about doing the teams that I'd done in like, the strategic investments or the mobile clinic management. But I ended up going and writing a story about a night shift during community service
Oh
and being the
wow.
only doctor in a rural 100-bed hospital with five other nurses in the emergency unit, and how that night, as chaotic as it is, if you have a respectful relationship with the nurses and the patients and the porters and the people around you, how you can get through a night shift where everyone comes out alive or everyone comes out with the best possible outcome within the context of those limited staffing shortages, etc. So the director of the program was just so interested in this particular story that we ended up speaking about medicine and my time in medicine, and then moving into the early childhood development sector. So I think really being able to tell a story of who you are, where you come from, and being able to paint that picture as a South African doctor, for example, in my case, how that looks like on paper and what benefit that can be. And I think for me, my benefit to the it's not only about getting something out of the MBA, it's about what can you do in the MBA that's important. So I had always put forward that coming from this space, I want people that are wanting to do ventures, new ventures, that are wanting to do, go into investment banking, that are wanting to, start up the next best thing is how do they think about philanthropy? How do they think about communities in their businesses? How do they do business for good? And how to, like I said earlier, build with communities rather than for communities. And so that was my value proposition ad, was to say this is something I want to do in the MBA program. So yes, the process was a long, almost a year-long process of applying for the Chevening Scholarship, applying alongside to the universities and getting into the universities. Um, and so my lucky streak, I would say, was that when I had looked into the Cambridge MBA, the previous director of the program was a South African. And so they offer a scholarship to a South African national every year. And so for
Wow.
me, alongside the Chevening Scholarship, I was also awarded that scholarship. And so together, they really, really allowed me to like take up this opportunity. It's extremely expensive, these international MBA programs, and so I feel very fortunate and lucky for those things to have aligned up to make this possible. And so really, I think it's really about doing your work, homework, because I remember sitting with an Excel sheet and I'd had every MBA program that I was interested in. I had all these scholarships that were potentially aligned to that program. I had the deadlines for them. So you do have to do the work. It's not just like, a walk in the park, I would say. But it's something that if you have a plan for, it's 100% achievable.
Wow. So would you say the secret sauce is in the essays that you write? Because it sounds like if you're able to hook them on that, it's smooth sailing from there.
No, I agree. I think so. I mean, there's a balance, right? So, when you think about these amazing, top 10 universities in the world, like Oxford and Cambridge and, Harvard, etc., you have to first, um, they look at your undergrad marks, so submitting your undergrad portfolio, but they look at more than that. It's not just about whether you did well in your undergrad. It is in your essays. How do you how have you been more than just a doctor in your community, in society, etc.? How do you paint that picture of, you wanting to achieve more or do more in that space? Um, and then also what's unique and I mean in that space as well. So like was there a moment of, an entrepreneurial spirit? Was there a moment of like branching out and doing like strategy consulting? What was a little bit different from your traditional route that you want to explore and do a little bit more in? And then the other part would be your GMAT component, so looking at your GMAT mark, and then your interview experience. So I think it's really about all those components, and they are weighted very differently. So I think, yeah, I think when it comes to articulating yourself, that's the best chance you have in an essay, is because people are reading and evaluating that. So I always say I wish I could be an author one day or write stories because I love telling stories. And sorry if I talk too much all the time, but I think for
No,
me,
no,
when
it's
it came to
good.
the
It's good.
essays, when it came to the essays, I just loved, telling my story. And I loved doing it in a flavorful South African way because I don't think people realize what a flavorful country we are in and live in.
Mm,
And so it was really nice to tell that story. For me, I had to tell that story about me being a young Indian South African moving from Durban to Cape Town and having to navigate, different cultural changes, having to navigate the different languages, and how that's, been part of my identity and sometimes my identity crisis. So it's like, being able to tell that story is important. Being able to tell people who you are and what you offer is important. And selling yourself, sometimes you have to say, I did this rather than me and my team did this. So you have to get into a mode of backing yourself in a certain way.
mm.
And sometimes we feel uncomfortable doing that. So even in the chevening scholarships, like they like, don't tell me what your team did or what you did with your team. I want to know what you did. And so you have to be able to articulate that. There's this big, this acronym that they use. It's called the STAR acronym, about being specific about what you're trying to solve for, what the task was at hand, what action you did, and sort of what was the result. And being able to like articulate your essays using that format has been really useful, even for the MBA essays.
Wow. No, I think definitely selling yourself is something necessary even in networking. As I'm learning, it's about standing on what you have done, but not in an arrogant way, but in a way that positions you as someone who knows and is confident. So it's a skill. It's a soft skill to have.
Yeah. I mean, networking is an important one. I think there's an essay in Chevening on networking, and I started my essay saying something like, I find networking really exhausting, and it's burnt me out in many occasions. And that was like my provocative initial statement to an essay. And sometimes it requires you being that way. And the truth is, yes, networking is amazing, but it's extremely exhausting. So you have to also be strategic about who you decide to network, how you pick your network, because you can't be everywhere all the time. So I mean, even in that case, your network circle needs to be well thought out.
Definitely. So when it came to the scholarships, did you only end up applying for Chevening?
So yeah, so this is why I'm saying I was a bit lucky in that regard because I'd only put my bets on Chevening.
Wow.
And yes, I know it's a highly competitive scholarship. I mean, this year we had 100,000 applicants across the world, and with 27 that were selected in South Africa. So I backed myself highly. I'd known about the Chevening scholarship and I'd known about the internal scholarships at Cambridge. So when you apply at Cambridge, for example, you can tick all the ones that you're eligible for. There's another South African that's in my cohort. I met her for the first time when I got here, who got a scholarship for global impact, for example. And so there are a couple of scholarships available internally, and there's a big Chevening scholarship. There's also the Commonwealth Scholarship. There's the Marshall Scholarship, which are all fall under that Foreign Commonwealth and Development Office. And then, of course, there's the scholarships that are available in the States, and there are a number of them which I didn't necessarily apply to. But there are a couple of scholarships I know for African students in Harvard. So there's a specific scholarship for them. Um, and so there's a lot of things. There's a lot of scholarships available for the African continent, for South African individuals, and it really requires you going and searching for them. And this is like where ChatGPT and things are so useful because you can actually just
Mm,
ask or prompt it to be like, list the scholarships available for a South African between the ages of so and so, and it could pull out that stuff to help you create that matrix to start going down that list. Yeah.
definitely. I think in life you just have to shoot your shot because if you land, that story time will be incredible, as in your case.
Yeah, no, I think so. I think for me, it was just one of those case scenarios where I think peop things fell quite nicely. I'm at this age in my career. I mean, I think quite young in my career where I think this journey is going to catapult sort of the next story for me. I don't know what that looks like, but I'm excited to be in that phase of like the uncertainty of what's next.
No,
Um,
definitely.
which is funny, right? Because remember, the uncertainty of like post-community service is not exciting at all. But
Mm.
this is for the first time where I'm like quite excited about the uncertainty, which is an interesting place to be.
You're going to have an adventure. You're going to have a really good adventure.
Yeah, we'll see with the pound being quite expensive, but we'll see.
So, for any doctor who's curious about entering the scholarship route, how would you advise them based on your experience to go about this process?
So I think for me, I think when I was in university, I'd been awarded a leadership a bursary called the A. Bailey Leadership Bursary. And it was a fantastic time for me as a young leader to travel to the UK, have a global perspective, find out exactly what it means to be a global citizen. And through that experience, and then through this experience, even while applying for these scholarships, um, I have a lot of younger family members that are also applying for these scholarships or wanting to, do this in the future and have asked me this question. And I keep on telling them that they should not try to tick every single box. Like, you don't need to be this leader in every aspect of society. You need to figure out what your value proposition is, and you need to make sure that you articulate that one thing really well. So for me, it, for example, was when I was articulating in my essays, I was speaking about social impact philanthropy in that sector of work and how medicine, has allowed me to be a little bit more strategic in that space. Um, Even when I came into the DG Murray Trust, for example, I very quickly realized I was not an ECD expert, but I was a medical doctor with a sort of management, public health facing experience. And so I was like, that's my value proposition. And how do I run with that and make that work for me? So I think even when people are applying for scholarships is to own into what their value proposition is and really be able to articulate their skills, their strengths, what they bring towards a team or in a room, what they can contribute, and then of course what they're passionate about. So um, I mean, if you're passionate about something specific, I think really go for it and go all in because you want the people, you don't want to be inauthentic and you don't want to lie to people. So when you get to the program, you don't want, people to look and say, but you said these things in your essay or you said these things in your interview, but this is not actually what you enjoy or what you like doing. So definitely make sure that you know what you're passionate about and put that passion on the page so that the people that are developing you in the MBA program know exactly where to push and pull from you to get you to that space. If you're going to, over exaggerate something that you never did or that you don't know how to do purely just to get in, I think that just makes it a little bit more difficult for you to work with people. So I think being authentic, knowing your value proposition, and articulating your skill set is the key.
Sure. No, that's incredible to hear. That's incredible because we are all unique and you just need to hype your uniqueness and that's what's going to get you far.
Yeah.
So now with regards to unemployment, because that's a very, very big topic in our country right now,
Yes.
especially among us as doctors. How do you advise or what tips can you give someone who is community service, about to finish, or just freshly finished, how can they navigate this uncertainty?
Yeah. Um, so I think this is a I might be speaking from like a place of privilege in the sense that I've never taken a break post community service. And it's not because I was, um, like I said, I had very late in my community service year sent out an email to the research organization to say I'm looking for a place, and it so happened that they were interviewing. But I think a lot of my friends, for example, that did get a post community service were actually emailing, departments and sending out CVs by like June or July already, which I was like, what? I didn't even know
Mm,
that was a thing that was happening, but that is, the reality. So I think one of the things that we need to be telling people is, yes, while we are trying to figure out, how do we get more doctors employed, and especially doctors that do want to specialize and they need to go through state to do that, is to start early in terms of planning out their CV, really looking and seeing how if their CV is in line with the different departments because it might require that you might have multiple CVs. I think I had a a um, a folder on my laptop with about 10 different CVs, like one for research, one for internal medicine, one for pediatrics, one for the things that I was interested in. But I tailored out my CV for different things, um, because you don't want to be sending a um, you know um, a CV for research to, for example, the Department of Anesthesiology. I don't know, like, you want to be able to say that I'm, interested in this and I have the skill set for these things. And you want to make sure that it's up higher on your CV. So you really want to make sure that if you the things that that department needs need to be on top of that CV because people get bored and they skim
mm,
through CVs and they don't look at things properly. And there's even like studies to show where people look at CVs and where they lose attention. So you need to be also strategic about that. So I think plan early. But I think the other thing to say on the other side is that when you take the risk, you need to know that that risk comes with reward, but not immediately. So it might mean that when you decide to do the medical pivot, that you might have a cut in your paycheck. That's not necessarily at the level of the other doctors that are earning, but knowing that there is potential to build up and grow and get to a point where you are comfortable. Like for me, that was always the difficult thing to say. Um, am I at the place where I can be at the best earning potential while also doing work that I love? And for me, that answer was yes, where I was like, I can grow in the space, even though I'm not at the earning potential that I'd like to be. But for example, I was in my bed every night and I was not doing, overtime and I was starting to reintegrate into society and like make friends and like go out for a dinner every now and then and have more time with my family. And those things were really important to me. So it was saying, yes, I'm going to take this paycheck cut initially, and then I'm going to build myself up in the sector. Until I got to a point where I felt much more comfortable. I felt like, oh, well, this is actually a place that is sustainable for me if I, use my expertise. And I'm not saying that it's not hard work. I mean, you work really, really hard in civil society, you work really, really hard in public health. Um, but it just takes time. So it's about saying, I know that I'm not in the space that I'd like to be right now, um, but I can get there. So I think taking that risk is important. Like I told you, I left a 5-year contract or potentially 5-year contract for 8-month contract. And even back now, I think that was gutsy of me, to do that. Um, and so, yeah, I think take the risk, and then if not, plan really well in advance. Go out to people, meet people, show yourself at different events or conferences. Go and speak to the head of departments. I know it's so difficult to network in that space, and I know that it's sometimes really even difficult to go up to someone. But people remember faces and people remember initiatives. Um, like I know in my organization, people come to the door and just hand in their CV, and sometimes those are the people that get hired just because they put themselves out there. So yeah, I think put yourself out there and do a little bit of a risk assessment, and see what works for you.
Wow. No, no, you've dropped so many good nuggets and so many stories. I can definitely tell that whoever's going to reach out to you, you are going to definitely help them a lot.
I hope.
Yeah. So on that note, where can the people find you online? If anyone wants to connect, anyone wants to go deeper in any part of your journey.
Sure. I mean, I think I'm available on LinkedIn and I'm starting to become a little bit better on LinkedIn, in terms of like mapping out my professional journey and starting to sort of really have a little bit more of opinions on things that are happening in our country and globally. So LinkedIn's a good place. I'm not the biggest social media person, but LinkedIn, I always am there and willing to help and support. So people can reach out to me on there, and follow along on the journey. So I've just started the Cambridge MBA. So I've already warned people that they need to be prepared for the spam that's coming along with it. So yes, I think that's a great platform. And I think even as young doctors in the space, you don't realize how important your LinkedIn is. Like you
Mm,
can start building your profile on LinkedIn because people are, using those platforms now to as another screening way. So I think that's a nice place to start.
yes, definitely. I think everyone should have a LinkedIn from the time you're a student because it does so much for you. It really
I
does.
agree. I agree.
Yeah. But thank you so much. Thank you for being here, Tavares. I have also taken a few nuggets from your journey. Definitely just be audacious and back yourself in this life.
Yeah. No, I agree.
Oh,
And
wow.
I mean,
Okay.
what I wanted to say was, thanks for this, Diane. It's been a pleasure. And I think, what you're trying to do in terms of shifting the narrative and getting people to talk more about it, I think it's going to be one of those transformational things of really getting people to start thinking out of the box and starting to value themselves and allow themselves to pivot if it is a pivot, or allow themselves to go through the traditional route if it is that way. So, yeah, thank you for opening that space up for us.
Definitely, definitely. Okay, so this is the end of the podcast. Thank you so much for listening here with us. And yes, this has been Redoctoring. Please do follow us on all social media platforms and follow Dr. Chavaris on LinkedIn. We are definitely welcoming that spam. So, just to close us off, my name is Dr. Diane, and this has been Redoctoring. And yes, check you out in the next episode. Bye.